patients of ectopic pregnancy come in a collapsed condition, generally looking very pale, and they have history that they have missed a period.
You are watching Surgery Simplified. shastrakalasaralshabdomein.
Hello, namaste. Welcome back to our channel Surgery Simplified shastrakalasaralshabdomein. मेरे साथ हैं डॉक्टर निखिल.
नमस्ते.
तो डॉक्टर, हम पिछले कुछ एपिसोड्स में acute abdominal conditions के बारे में डिस्कस कर रहे थे and we spoke about conditions that happen in men general and kids की भी बात की हमने. तो are there any specific conditions that happen in female?
Yes, indeed there are. So, अगर हम फीमेल्स को या स्त्रियों को देखते हैं तो उसमें भी कोई कंडीशंस है जो acute abdomen प्रेजेंटेशन होता है. And though surgeons are not gynecologists, many conditions do land up with the surgeon. The reason is because the symptom is severe pain in the stomach. Okay, severe generalized pain in the stomach of sudden onset. Okay. Now, what are the conditions that I want to discuss and point out? Again, out of this, one condition is potentially life-threatening. The other two are not that life-threatening, but can be life-threatening if neglected over a period of time. So, the three conditions that I would like to discuss, one is a twisting of ovarian tumor. Alright. The second is gangrene within a fibroid, which is a tumor which is very much specialized to the uterus. It happens only in the uterus. And the third is a ruptured or burst ectopic pregnancy. I will come to that. So first let us consider ovarian tumors. Now since only females have ovaries, so ovarian tumors, which can be generally what we call them as dermoid cyst. Alright? It is basically something what people say is like an aborted pregnancy. It's like that, one of the theories, because it has got features like, it may have some hair, some teeth inside the tumor, as if it is trying to form a fetus and it got aborted. Hence it is known as a teratoma. That means something which has got everything, ectoderm, endoderm, mesoderm. Now, when the body is developing, certain things are formed by the ectoderm, such as the hair, the skin, the teeth are ectoderm. Mesoderm forms all the muscles and the endoderm forms all the glands and the intestine. Now these are three broad categories of tissue which differentiate into a proper baby. So these three tissues are in that tumor. That's why it's called teratoma. So all the tissues which normally make up a fetus are in that, but it forms like a tumor. And this is a very common tumor which is seen in ovaries. It's not per se common as a tumor, but within ovarian tumor, it is a common tumor. Now, sometimes what happens is this tumor grows to a large size and the person doesn't even have any symptom, because it doesn't cause any symptoms initially. Why? Because the ovaries are in the lower part of the abdomen. By the time it grows, there is a lot of space. It can push the organs and keep growing. I've had a person coming who was a widow who looked pregnant and was being, all the people are saying कि किधर जाके मुंह काला करके आई है करके. Poor thing had an ovarian tumor which is looking like a pregnancy. Understood? So it can grow that big without causing symptoms. So when it becomes big, they come to us for surgery. But it is that in-between size, say the size of a big musumbi or a small watermelon or a papaya, that size tends to rotate with the weight. With the weight, it rotates. And when it rotates, it cuts off the blood supply to it. And then it starts becoming gangrenous. That's when the patient gets very severe pain. So a twisted ovarian tumor is a condition which can come as acute pain in the stomach. It is readily diagnosed by doing an ultrasound and definitely directly needs surgery. You have to remove the ovary with the tumor directly. That's the end of it. Generally, it's not a fatal condition. The second condition is some of these ladies who have got fibroids, they are tumors which arise in the uterus. Now, for some strange reason, we don't know, some of them undergo what is known as red degeneration. It is what it does is that the fibroid tumor, which is like a white fibrous tumor, like a white tumor, it whirls of fibrous tissue, suddenly become very soft and mushy and reddish in color, as if it is developing gangrene. We don't know what is the reason why this happens exactly, but it does happen. And again, it is not very common, but it can only happen in a female. And it again needs either removal of the uterus if the lady has completed her family, or removal of that fibroid. Again, it presents with acute pain in the stomach. And the most important condition, which is most common, which I have seen, and if you don't operate, patient can die, is a ruptured ectopic pregnancy. Normally what happens is that the ovary gives out the ovum. Then there is a tube, which is called the fallopian tube. The egg starts traveling through the tube and comes inside the uterus. And the sperm comes up after intercourse, the sperm comes up through the vagina into the uterus, and the consummation of the sperm with the ovary happens inside the uterus, and then it gets impregnated into the wall of the uterus and starts becoming a baby. This is the normal thing. Now, for various reasons, sometimes maybe the lady had tuberculosis, so that ovary is somewhere scarred, or some other illness, or she had some infertility treatment because she's not conceiving, and then sometimes it is known to happen with infertility treatment sometimes, where the stimulation of pregnancy happens and more ovums are released than one. So the pregnancy gets, the sperm goes into the tube and meets the egg in the tube rather than in the uterus. Now the pregnancy starts growing in the tube. So it's called as a tubal pregnancy. Hence it is called ectopic pregnancy. Ectopic means not in the normal position outside the uterus. It could happen in the ovary or it could happen in the tube, but commonly it happens in the tube. Now obviously, such a lady who has got a pregnancy, obviously that pregnancy cannot go beyond a certain time, then it will rupture. When it ruptures, it bleeds torrentially. And very quickly the patient goes into shock because of loss of blood. Okay. Of course, there is pain. So patients of ectopic pregnancy come in a collapsed condition, generally looking very pale, and they have history that they have missed a period. So the best thing to do is do an ultrasound and a urine pregnancy test, or you can do HCG, human chorionic gonadotropin test, which is very accurate to know whether a person is pregnant or not. Sometimes urine pregnancy test in ectopic pregnancy may not come positive, so it is misleading. But the blood test is definite, and the ultrasound will show ruptured ectopic. Now this is a dire emergency, and it is very rewarding. I have seen collapsed patients have operated and they have come out the next day. It's the most rewarding surgery I have seen, because once you stop the bleeding, of course you have to remove the pregnancy along with one-sided tube. So there is only one tube for the person to conceive. Many times this happens, as I told you, people undergoing infertility treatment also, or who have not conceived. So they are trying for stimulation of ovum and all that, some with medicines and all. So they are a little reluctant, because what happens if one tube is gone? But they can conceive with the other side. There's nothing to worry. But very important, if a patient is complaining of giddiness, which is because the blood pressure is falling, looking pain and pain in the abdomen, you must immediately shift her to a place with surgical facility. You must. There is no chance. If this is touch and go, because the bleeding is so torrential, it's like very torrential. And when you open the abdomen, all you see is blood. You have to suck out the blood and immediately catch the tube, and the bleeding will stop, and the patient will start coming out, blood pressure rise. Of course, you need to get blood immediately and give that. All that is there, but it is easier to treat it and save, because it is not an illness. Pregnancy is just a physiological condition. So the mother is generally healthy woman. So she comes out also very fast. Unlike if it's a typhoid perforation or a tuberculous obstruction, there already patient is having other illnesses. Here that is not the case. It's very rewarding. So again, take home message is, anybody who has missed a period or not missed a period, may be trying for pregnancy, suddenly complains of giddiness and looks pale, sweaty, and BP starts falling, or she's not able to stand up, has a fainting spell, and complains of abdominal pain, rush her to the hospital. Literally rush her to the hospital, because the earlier you reach, the chances of that person surviving is more. Okay, so please do not neglect this one symptom, which is severe pain in the stomach, which we call as acute abdomen. What is there? Because we call it as a Pandora's box. What you see and what you open and what you get many times is, sometimes you end up with large surprises, and you have to tackle it, whatever it is. But if you're capable, you can most of the times tackle it, and patients do well. But we must give us the time to save you. It's like that. What I would like to tell all the patients is, give us the time to save you by not delaying a year low or treatment low. See, every disease doesn't have a medicine. If every disease had a medicine, then the field of surgery would not be there, right? There are certain conditions which have to be treated by surgery, and sometimes they have to be treated by emergency surgery. This is very important to understand.
Okay, all right. Another very valuable episode to all our viewers out there. So thank you so much, Doctor.
Thank you.
Thank you for your time. And if you have any questions regarding this episode, if you want to share anything, let us know in the comment section below. And अगर आप चाहते हैं कि हम कोई particular topic पे discuss करें, तो वो भी आप comment section पे बता सकते हैं. And if you like this episode, please hit that bell icon, subscribe to our channel, like, share, and stay tuned for more interesting and important episodes coming further on. Thank you so much.
Thank you.